Hello and welcome, everyone. I am Betty Morin. I am the Event Logistics Coordinator for Connect Summit County, and I am thrilled to welcome back Sherri and Todd for this follow-up conversation on our Crisis Response in Your Community event on September 11th, which was also a follow-up to another event that we hosted in August, which was a documentary screening of the Sundance film Bedlam, and a panel discussion that we put together along with the YWCA-Utah to talk about policing mental health. So if you're interested in either of those events as well, you can go to the blog on connectsummitcounty.org and you can see where to watch those events. So without further ado, I'd like to introduce Connect Summit County's Impact Director, Wendy O'Leary, who is going to lead this conversation.
Thank you, Betty. So we have with us today Sherri Wittwer and Todd Souter, and I'm going to let them briefly introduce themselves in case you weren't at the original event where they were introduced. And then I have a few questions that were follow-up questions that we didn't get to at the last event, and I will just ask them and they can both chime in and answer. Do you want to introduce yourselves really briefly, what your role is and who you are, Todd and Sherri?
Sure. My name is Todd Souter. I'm a psychologist and am the director of CIT-Utah, which is a nonprofit group that provides training and crisis response systems throughout the state of Utah, training for police officers on how to best respond to crisis situations, and then also working in various communities to build the best crisis response systems for people who have substance use and mental health difficulties. I'm also the director of intensive services with Davis Behavioral Health in Davis County.
And I am Sherri Wittwer, and I'm the board president for CIT-Utah and a longtime mental health advocate. I've worked in different capacities with policy and advocacy, and I'm a family member.
Thank you. All right, so we're going to jump right in. And the last time Sherri and Todd spoke, and I really appreciated how Todd Souter explained how Davis County operates and has a really great crisis response system or model in place. And I remember thinking how both of you emphasized the importance of not just the crisis response service itself, but the collaboration between all the agencies, law enforcement, mental health, and having that long-term goal of linking the person to treatment and recovery and stability, not just the immediate crisis. So I wanted to ask you, are there any other places in Utah that are similar, working in a similar way that Davis County is working?
I don't know specifically how other regions are working compared to the way things are in Davis. I've been really intimately connected with the situation in Davis County because I've been around here for such a long time, over 24 years at Davis Behavioral Health, and have worked as a regional coordinator with CIT for over 10. And so just over time, those relationships have built. I know in talking with other areas and getting more comfortable with other areas, there are good relationships. I know Weber County has a very good one. Utah County has a very good one. Cedar City and St. George areas have good relationships. And I'm learning more and more. We have an academy coming up in Tooele next month. We have an academy coming up in Brigham City area in about a month and a half. So I'll learn more and more about those areas. At this point, I don't know if there are similar systems, but I do know that there are strong relationships and building relationships in other counties. The one thing that I would recommend for counties is to allow people to be in positions where they can influence those relationships and allow them to be in those positions for long periods of time. I think that's been one of the benefits to our opportunity here in Davis County. Is I've been in my position now for well over 15 years, working with crisis and building relations with law enforcement, being the CIT regional coordinator. And my counterpart on the law enforcement side of things, Lieutenant Travis Lyman with Layton City Police Department, has been in his position with respect to CIT for about 10 of the last 12 years. So those two relationships working together, we get to know one another, we build trust with one another, and we assist one another in the different intricacies of our population. And because our relationship, Travis and my relationship, is strong, we're able to communicate and grow and develop better long-term systems for our consumers.
Great. And I don't know if Sherri has something to add, but I want to know, is there a list of CIT-Utah trained officers for each county, or do you have a list of how many in each county are trained?
Right, that's a really good question. And CIT-Utah manages a database where we track all officers that have been trained through CIT-Utah and all the officers that have been recertified as well. So we have a list of both active officers with active certifications and those officers that are have been trained but are not currently active. One of the great things about the way our system is built is that we will send emails to those officers as their certification is coming up on expiration or coming up on the certification being lapsed. So we really want our officers to be trained and recertified. We give them multiple opportunities and efforts for recertification, multiple avenues to gain those hours, and really try to keep our officers, once they have been trained, keep them active in their certification. We also want to lift that burden from the various departments and agencies that participate in CIT-Utah. We lift that burden from those departments in terms of tracking their officers and try to take that from them. Just another, I think, service and benefit to being part of CIT-Utah is the agencies themselves don't have to track and follow their officers. And hopefully with our system, the way it's built, with emailing those officers, reminding those officers, that it will help them stay current and active. So yes, there is a list, and we maintain that really on a real-time basis, on a daily basis, to make sure that our officers have the best opportunities to stay certified.
So this is something Sherri and I have talked about, and I'd like to hear from both of you about, like, so there's law enforcement agencies that say we're CIT, and I was participating in a CIT training and I found out it was a CIT Metro training, and I had never heard of that before. They told me that CIT Metro is the same as CIT-Utah training. Can you explain the difference? And I didn't notice much collaboration between the training and the mental health. If you could explain the difference, what is CIT-Utah, CIT Metro, and what would be the value in one or the other?
So I will say CIT-Utah's program follows CIT best practice standards in how we train and create and develop partnerships with community partners. And CIT-Utah has been contracted with the State of Utah Division of Substance Abuse and Mental Health to provide the CIT training and the program for the State of Utah and certifies the officers through this program. So one situation we have in our state is we have some areas that are following best practices and following the program. We have some who have decided to do their own internal trainings, and then we have some that still don't have any training at all, or maybe some basic mental health training. And so we really believe strongly in adhering to the latest standards that we've been given, the information that we've been given for best practice. And part of that is, as far as training all of your officers, there's been a lot of talk about that, how a lot of areas say, oh, we've got to have all of our officers CIT trained. And I get the sentiment. I appreciate the interest and the value they're placing in mental health training. What we would like to see is that all officers get mental health training, all officers get de-escalation training, but we maintain a specialized cadre of officers who have advanced specialized training in mental health and who have built those partnerships with mental health providers. So when there is a response necessary, sometimes it may be a mobile crisis outreach team that responds first, and then they call law enforcement for backup, but they know who those partners are. And other times law enforcement may get the call and be the first to respond, and then they reach out to mental health, and it's a team. CIT is not training, it's teams. And they know each other, they have the relationships, and because they work on together so often and work with the community, they get to know the people who are calling oftentimes and get to know, you know, we've got someone who's in crisis, they know who they are, they know how to best respond. And so it really is about building those relationships and making it community driven. Great,
thank you.
And I would like to add a couple things, if you don't mind, Wendy. One of the things that CIT-Utah has as a high priority is to try to reunify the state. So all of CIT is under one program, and we have had meetings over the past several months, although they've been put on hold due to COVID. But we've had meetings with the CIT Metro agencies, and our effort has been to offer those agencies to partner up with us and to try to continue to build one statewide system that establishes consistency. So when a person in any community requests or asks for a CIT officer, we want to try to get consistency throughout the state. I know the Metro Group is driven to provide high quality services as well. Their motivation is certainly to try to do right by their communities, and we just want to extend ourselves in partnership with those agencies to be able to continue to grow our program. I think it's much easier on the community and easier actually on the officers themselves if we were all under one umbrella to be able to serve our community better, to be able to build crisis response teams like Sherri had mentioned, teams in the community that work as a partnership between mental health, law enforcement, and advocacy. So all areas are providing input and feedback to our program so we can continue to be responsive to our communities. So that's one of our major priorities right now, is to try to get an entire statewide system all under one umbrella, and are hopeful that the CIT Metro agencies will be open to ongoing conversations to try to achieve that.
That's great. I appreciate that. This is kind of a different question. Have there been any changes in the state law, code, or rules that prohibit law enforcement from transporting an individual to the ER for a mental health assessment? I was told by a responding officer in one county that they can transport individuals to jail. So if they commit a chargeable crime while they're in a mental health crisis, they would take them to jail, but they can't take them to the hospital anymore. They're not authorized to make that decision. And so that was new to me, and I just thought I'd ask you, you guys,
I can speak to the best of my knowledge, and as far as I'm aware, there's no change in the statute about how people are transported under the civil commitment statute. So I think what may be part of this discussion may be an agency by agency interpretation or department by a department interpretation. So, for example, if someone is placed under a pink sheet, which is an application for involuntary commitment, that those circumstances would then fall under the commitment statute, which does indicate how and by whom those individuals will be transported for an evaluation. However, if they're not under a pink sheet status, then they wouldn't fall under that commitment statute. And then I think under those circumstances, it may be left up to interpretation by the department or by the law enforcement agency. And again, that's where these partnerships really can serve the public well, is that there's ongoing relationships and discussion between the mental health authority and various law enforcement agencies in that catchment area. We can try to work together to find, again, the best solutions for our consumers. Sherri referenced it earlier where she talked about, hey, sometimes in a crisis situation, law enforcement may be the first responders. At other times, the mental health team or the MCOT team would be the first responders. But that those two groups or those two entities work together consistently in a dynamic way to be able to address those situations with the primary focus or the priority being, one, safety of everybody involved, and two, what are the best needs of that individual in the community. I know there was a piece about MCOT that you talked about earlier, a question. MCOT stands for Mobile Crisis Outreach Teams. Those are mental health professionals and peers who work together as a team to provide crisis response in the community. So we try to meet the consumer at the point of their crisis. So it's not necessarily just responding to the emergency room or to the jail or to a residential facility. It's responding to the consumer and the family at the point of the crisis. So often we will go to homes or areas in the community where we can best serve the clients in an environment that's more comfortable to them. Sometimes those responses are just the mental health team or the MCOT team. Sometimes they're co-responding, in other words, responding with law enforcement. It's really a situation by situation basis. Now, MCOT, again, the Mobile Crisis Outreach Team, there are multiple communities throughout the state that have MCOT teams, and there are certain criteria that drive whether MCOT can respond or not. And those criteria are basically based on safety. Is it safe for our teams to respond in those situations? When it's not safe, obviously we don't respond, or we respond as a secondary presence to law enforcement so they can ensure safety. However, there are times when it may not be appropriate to respond. And again, those are a case-by-case basis, but in my opinion, based on safety. My advice to communities would be, if you feel like there's a crisis situation, call MCOT. Call the crisis line, the statewide crisis line, or your local community crisis line, and request a service or a conversation with the crisis worker to determine what kinds of things can be available to you. But the MCOT teams, again, Mobile Crisis Outreach Team, with oversight from the Division of Substance Abuse and Mental Health, those MCOT teams are designed to go out into the community in a manner that essentially the crisis is defined by the consumer or by the family to be able to respond to those needs of our consumers. Again, it's driven to serve people. And if the MCOT teams are not doing that on a consistent and regular basis, then we want to make sure and get feedback to be able to improve those response systems and to improve and continue to grow relationships between law enforcement and MCOT teams to provide the best services in the community.
Thank you, Todd. And so what I'm hearing is that MCOT are going to be responsive to any mental health crisis. There might be occasions where they feel that they might not be safe. So law enforcement may respond, but they might communicate with the team, the mobile crisis team, for direction or to stabilize the situation before MCOT shows up. Is that correct?
Correct. And we're really working in partnership on a case-by-case basis. Okay. Again, the two most important factors are safety and then providing good care and services to our community.
Okay, and I had another question somebody else asked. I believe we touched on it a little bit on the last call. Is substance use disorder, somebody who is addiction, is that something MCOT responds to, or would it need to be a co-occurring situation?
That's a really good question. My response, at least I can speak to Davis County MCOT, is we respond to any crisis situation. So that would not disqualify. Substance abuse would not disqualify. Neurocognitive issues, such as autism, would not disqualify. We want to respond to any crisis situation in our community. Again, making sure that safety is ensured for both the client, our MCOT team, and law enforcement can be a part of that. That can certainly assist.
Okay, great. And then I've heard that you can go into your local sheriff's department or police department if you're in city limits, and you can let them know that you have a person in your home who has a mental illness, and sort of it's supposed to act as a flag. And I know like the Park City Police Department has something on their website where you can fill out a special needs form. Do you know if that is helpful? Is that something you would recommend, you or Sherri would recommend to people to do?
I would recommend that. I think that's really a very helpful avenue. Again, I can speak more to Davis County because that's the MCOT system that I'm familiar with, but our dispatchers and our law enforcement officers, when we know the client and have more information, it gives us a better opportunity to try to connect with them and communicate with them in a partnership way to try to get the best outcomes we can. Going to your local law enforcement agency and requesting that information be placed into their system or database allows for that to happen. And when that question was posed and when you sent it over, I thought that was really a well-informed question and really good idea to take initiative to make sure that yourself or your family members, your loved ones, that all the information is out there so we can make better decisions and have a better understanding of how to best approach our people to provide the services we want to provide, which is to be done in a compassionate and empathetic manner with the goal of resolving the immediate crisis, but also providing the best long-term outcome that we can for that person.
So if you go to the agency, the law enforcement agency, and you provide this information in advance, is that going to actually come up and be a flag for dispatch when they plug your address in? And is that going to help them respond with CIT? Or
again, a great question. I think that would be, you'd probably get a better answer if that were a question asked to your police chief or your sheriff in your county and how that system works. I know when I am on crisis, I still do crisis work in Davis County, and I will speak with dispatchers who will have information and have familiarity with some of our consumers in a way that is helpful both to our MCOT team and our law enforcement officers to be able, again, to provide the best opportunity and get the best outcomes we can.
If I can just chime in, I think this is really the opportunity that advocates have in determining what's in your community. There are best practices, there are standards that dictate how these programs should operate, but it really can vary, and there are different reports. And so it really is an opportunity for advocates to get involved with their community, to ask these questions. What does MCOT look like in our community? How does this run? When will they respond? When is law enforcement involved? What can we do as individuals affected by mental illness and families to help that process and to be proactive in preparing for a potential crisis? And I just want people to feel more empowered rather than helpless and what do we do? And so that's something we all need to be working on, and coming up with tools for individuals and families affected by mental illness.
Would you recommend, as a place to start, I know in the county that I live in, I've gone to both the mental health director and to both law enforcement agencies and brought up these questions and spoke to CIT-Utah and the collaboration. I don't know what I do next.
Yeah.
Do you have any ideas?
Well, I think it is important. Really, when CIT was brought to the state of Utah, and it still continues to be a very grassroots organization, in that advocates were often the ones who introduced CIT in their communities and brought stakeholders together, and had connections with law enforcement, mental health directors, and other stakeholders to help get those programs implemented. And I think that's still what we need to do. I think it's helpful for families to know, so who do I call? And that's where CIT, when they designate, here are our specialized officers, it's not just anyone, it's here are the experts in our department in mental health, and they know the system, they know how commitment works, they know the resources in the community, they know who their partners are. That's something that can be done.
All right, thank you. And we are out of time. It's 2:30. So I appreciate you both, Todd and Sherri, for coming back and answering some questions. And it's a topic we could talk about forever, but I'll talk to you offline, get more information. So thank you.
Good.